Welcome to the Revita Health and Wellness Show. I'm your host, Francine Marie, and today we're here with Dr. Peter Fotinos. Hi, Doc.
Hey, Francine. How are you?
I'm great. So the early bird wants to catch the worm, but not at 3 a.m. when we'd rather get up at 5:30 a.m. or 6. Wow. Should we just get up? Is that a sign that the universe is sending us that... What is that?
So when that is a very common thing that I see. So when I see somebody waking up around, they'll come in and they'll say, hey, I can't sleep. So what's going on with your sleep? Well, I'm waking up at 2 or 3 in the morning every morning and my mind's racing. The next logical question for me is, how's your stress? Because that's usually a sign that your cortisol, which is your stress hormone, is spiking at that time. And cortisol is related to the sleep cycle. Cortisol is high in the morning to wake you up and then low in the evening to put you to sleep. And you want a pattern that kind of it's scalloped, basically. I don't know the best way to describe this over the radio, but you want it to go up high and then kind of gradually drop off and then taper off to the end of the day. And what the realistic way it works is that because of stress affects cortisol, which is your stress hormone, it's actually going to be doing little spikes up and down through the day depending on what your stress level is. Cortisol changes from minute to minute, second to second, hour to hour. It's not like any other hormone that changes from hour to day kind of changes. So it's a difficult hormone to deal with. So when I see patients in that, I try to fix it by fixing the other hormones. Typically, testosterone and thyroid will typically fix cortisol. Probably about 70% of the time, I can get somebody's cortisol under control with testosterone and thyroid. But most of the time, 30% of the time, which is not most of the time, I'll end up having to look at their saliva, look at cortisol specifically. Now, I'm not a big proponent of saliva testing. The only reason why I do saliva testing, and specifically related to cortisol, is because we have to take 4 points in time. And saliva testing is easier because you spit in a cup, one in the morning, one in the afternoon, one at night, and one at bedtime, rather than draw blood 4 times one day. People don't like drawing blood. So that's what we got to watch out for. I don't like doing saliva, but for that test, it's pretty accurate because all you want to see what the pattern is doing.
Okay, the pattern, exactly. Because we think, well, I'll keep this silent for a while. I mean, we can go months waking up in the middle of the night. And, we read online that that's normal for your age. But we can always reverse that.
Yeah, you can stop that. Yeah, now that's one of the...
Is that the easier one?
That's one of the easier ones because most of the time when I hear 3 a.m., my first mind is right at cortisol. I know it's easy to diagnose. It's hard to deal with. Let's put it that way. So most people will wake up at 3 a.m. or 2 or 3 a.m. whenever they wake up, and their mind's racing. And that's a key that tells me, yeah, your cortisol is going up. And then they have a hard time falling asleep, and then they wake up throughout the rest of the night because of that. So that's actually a telltale sign, like I said, for cortisol dysregulation. If we're not careful, when we look at the pattern, it can end up going into adrenal fatigue syndrome. And a lot of doctors say there's no such thing as adrenal fatigue syndrome, but there's actually some good studies that show that it does exist. And I do have patients with it. And if you don't take care of it now, then you go into adrenal fatigue, it becomes an issue.
Got it.
So the way we look at it, again, I look at saliva testing. If your cortisol is too high, I typically give you supplements that bring down the cortisol, one of them being phosphatidylserine, another using, and we also use adrenal cortex support, which is basically substrates that are related to the spleen and to the adrenal gland to help kind of replenish the adrenal gland. Because you don't want your adrenal glands to tucker out or to burn out. The reason being is the adrenal glands are important for stress in the sense of if you get injured or an infection, you need the cortisol to help you heal and get through the stressful situation.
Right.
There is congenital adrenal hyperplasia, which is a disorder in which they don't make cortisol, and those people can die if they get an injury or an infection. They have to be constantly giving cortisol in that situation. This is different, but that would be the extreme of what you would see if you didn't have cortisol.
When do people normally the sleep patterns start changing?
That varies.
Okay.
There's now, depending on what sleep pattern you're looking at. So there's 3 types of sleep pattern that I see. There's people having difficulty falling asleep.
Okay.
People staying asleep, which would be in that cortisol, and people staying asleep and waking up early, depending on when you wake up, they could be related to cortisol. Most of the time, people that come and see me are the ones with the sleep disturbance, meaning they wake up throughout the night. Okay. Some occasion, I do have the people that have difficulty falling asleep, and those people, depending on, and that can be more sex related, meaning men versus women. Typically, women, when they have low progesterone or progesterone is not high enough, especially if we're not giving them enough progesterone, they won't fall asleep right. When you give them progesterone, orally especially at bedtime, because oral progesterone actually turns through a complex pathway into melatonin, which is what keeps you asleep. That's why when I give progesterone at bedtime, for women orally, I tell them to take it at bedtime. I don't tell them to take it because they'll be drowsy during the day. For men, what I see a lot of, if it's related to any kind of sleep disturbance, usually testosterone for most men. Cortisol is probably the main issue, but then right after that would be testosterone. So replacing testosterone. And then they go hand in hand because cortisol and testosterone are kind of mutually inverse related. So testosterone goes up, cortisol tends to drop, and vice versa. Cortisol goes up, testosterone. And I like to tell patients, if you see a bear in the woods, you don't want to have sex, you want to run away. Cortisol is the fight or flight hormone. Testosterone is the sex and build up muscle and get the girl hormone. They kind of don't work together well. So if your cortisol is going up, testosterone is probably going to be down. So you try to bring testosterone up to counteract cortisol. So.
Awesome. We can now get a full night's sleep, a rested full night's sleep, because sometimes you can wake up and you're still tired.
Yeah.
So this is good.
The other thing we do use is also melatonin. We do that. DHEA has also been shown, which is a mother hormone for all your other hormones. Probably one of the ways it does it by improving your other hormones, and also because it's been shown itself to improvement with sleep. Again, most people will use melatonin; they don't use it correctly. Melatonin needs to be what works for you may not work for me, and what works for me may not work for you. So the problem with most people, they think one size fits all, and that's not true with melatonin. First of all, you have to take the extended release, because if you take what you get mostly over the counter, which are sudden release, you'll get a big spike up, then you'll wake up and then you won't fall back asleep. You have to have it over time to keep it in your system to keep you asleep. So that's why you want a prolonged release, extended release, sustained release, whatever kind of something that prolongs the release. That's one thing. The other problem with melatonin, the way people take it, is that again, the dose for you may not work for me. So you have to bring it up slowly. So you want to start off, and you want to increase it by 1 milligram every night. Women start at 1 milligram and increase by 1 milligram a night. Men start at 3 milligrams and increase by 1 milligram a night. Women are more sensitive to it than men, so it takes less medicine. Most women are going to need 3 to 6 milligrams. Most men are going to need 6 to 9 milligrams.
Do most doctors know this?
Probably not.
And then, right.
Most doctors are going to put you on a prescription medicine, especially in something like Ambien or Lunesta or something like that, because that's what we know. Because I guess most people know that I used to be I am still a family practitioner. That's what the medicines we've been taught to put people on. Melatonin is rarely used, and it should be used more often than what it is.
Oh, that's good to know. Wow. Are we finished with our good sleep doc?
Yes, sir. Yes, ma'am. So.
This is good. We can call 704-847-0011 and get some sleep, or just log on to revitamedical.com. Thank you, Dr. Peter Fotinos.
Thank you for having me, Francine.